Tuloy po ang pagdami ng mga Pilipinong may chronic kidney disease o sakit sa bato. 7 milyon na sila pero posibleng mas marami pa. Hindi lang nila alam dahil maraming walang sintomas. Nakatutok si Mariz Umali.
Sabi nga nila, iba na raw ang henerasyon namin ngayon. Kami ang henerasyon na laging puyat at laging gusto ng pangmadalian. Gaya ng kapag wala na kaming oras magluto ng ulam, okay lang, basta may pansit canton. Pero sa bawat pagkain natin ng sobrang alat, bawat extra rice na mang inasal, at bawat oras na dehydrated tayo, ay para na ring pag-withdraw mula sa ating bangko na hindi natin alam na meron tayo. At ito ang ating mga kidneys. Kaya ngayon ay pag-aaralan natin ang pinagkaiba ng acute kidney disease sa chronic kidney disease. So ano nga ba ang function ng kidney natin? So ang function ng kidney natin ay nire-regulate nila kung ano yung nasa blood natin. Natatanggal sila ng waste products, ini-steady nila yung electrolytes, and also nire-regulate nila yung water. So bakit nga ba nagkakaroon ng kidney disease in the first place? So let's talk about first the acute kidney disease, or in short, AKD. It is a sudden decline in kidney function. It happens fast, sometimes because of severe dehydration, serious infection, or even the overuse of pain relievers like ibuprofen. So AKD is a decrease in kidney function that happens in less than 3 months. Kaya lagi natin tatandaan, kapag AKD, it's a sudden onset, it's serious, but it can still be a warning. But what happens when we ignore the warning? That's when AKD can progress into CKD, or chronic kidney disease. So if the kidney damage lasts for more than 3 months, it is already considered chronic. It develops slowly, often without us noticing. One of the most common causes is diabetes and high blood pressure. When blood pressure and sugar stay high, they slowly damage the kidneys over time. But it's not just that. It can also be caused by repeated infections, overuse of medications like pain relievers, and unhealthy lifestyle. Some risk factors are genetic, such as family history of diseases, but also our lifestyle makes it worse. Too much salt, processed food, smoking, lack of sleep, and not drinking enough water. In chronic kidney disease, symptoms don't appear right away. They develop slowly as kidney function continues to decline. Early on, patients may feel fatigue, weakness, and decreased energy. Other signs and symptoms include fluid retention leads to edema, swelling in the hands, face, and feet. As fluid builds up, shortness of breath may occur. Also, waste products in the blood can cause nausea, vomiting, and loss of appetite. In later stages, patient may experience decreased urine output, confusion, and even hypertension. These symptoms are not sudden, they are the result of progressive kidney damage over time. So, how do we confirm chronic kidney disease? We rely on different diagnostic tests such as blood, urine, and imaging tests to assess kidney function. First, blood tests. Serum creatinine increases as kidney function declines. So ano nga ba ang normal creatinine sa katawan natin? Ang normal creatinine sa normal human body is 0.6 to 1.2 mg per deciliter. So, pag tumaas ang creatinine sa katawan natin, it indicates impaired kidney function. Among all the tests performed, glomerular filtration rate is considered the gold standard in assessing kidney function and staging CKD because it shows how well the kidneys are filtering waste from the blood. So, the higher the GFR, the better the kidney function. Ang normal glomerular filtration rate kasi sa katawan natin is usually 90 and above. So, kapag bumaba yung GFR, magiging more severe na yung kidney damage. So, here's an example of stages of GFR. So, as we can see here, the G1 is usually 90 or above. Normal yun. Pero kapag umabot na siya ng below 15, dun na yung kidney failure na tinatawag. Another test is urinalysis. Bakit nga ba natin ginagawang urinalysis? Because the earliest sign of kidney damage is proteinuria. Another test is imaging studies. Ultrasound helps assess kidney size and structure. Sa CKD kasi, kapag chinek sa ultrasound, mas mag-a-appear smaller siya due to long-term damage. To sum up, always remember this pag CKD. Kapag mataas ang creatinine, it means low kidney function. Kapag mababa ang GFR, it means nagwo-worsen na yung kidney damage. And pag may proteinuria, yun ay earliest warning sign. Now, let's move on for the medical management for acute kidney disease. Management focuses on treating the underlying cause, such as restoring fluid balance, discontinue nephrotoxic drugs, treat infections, and lastly, correct electrolyte imbalances. Next, for chronic kidney disease, management aims to slow progression and manage complications, such as controlling blood pressure by giving ACE inhibitors and angiotensin II receptor blockers as prescribed, controlling blood glucose for diabetic patient, and also follow a low sodium, low protein diet, and manage anemia and electrolyte imbalance, also dialysis in advanced stages, and kidney transplant for end-stage disease. So yung kidney transplant is last resort na siya for end-stage ng CKD. Now for the nursing management and consideration, so first, monitor intake and output. Second, assess for edema and fluid overload. Third is monitor vital signs, especially blood pressure. Fourth is monitor lab values such as creatinine, GFR, and electrolytes. Fifth is administer medication as prescribed. 6. Educate patient on diet and fluid restrictions. 7. Encourage adherence to treatment. 8. Prevent infection. And lastly, provide emotional and psychological support.